Hi everyone, it's Sarah again. Today we're going to be doing a complete head-to-toe assessment on Miss Barbie here, who's going to be my assistant. So let's get started. Okay, so before we begin our assessment, we want to make sure that we are prepared to see the patient. If there's any kind of background information or previous admissions that you could look over to get a kind of a general idea on the patient's past medical history, why they're here, any kind of problems that they might have, any medications that they're on. Go over that so that you are prepared to see the patient. You want to make sure that you have all of your supplies, your equipment, so you don't have to go in and out of the room multiple times. Before we enter, we're going to make sure that we knock on the door, protect the patient's privacy. We want to introduce ourselves, wash our hands, make sure that we identify the patient, and explain what we're going to be doing. We're going to take an overall scan of the room, make sure that it is safe for the patient. If you're in a hospital, you want to make sure that the bed is down low with the two side rails up, more as necessary for the patient's condition. We want to make sure that the bed is locked if you're in a hospital room. If you're in a doctor's office, make sure that the patient is comfortable and safe on the exam table. So then we're going to go ahead and take a set of vital signs. On the patient, we want to make sure that we check temperature, which can be orally or axillary. It should be between 96.4 and 99.1. We're going to then do blood pressure, which systolic should be between 100 and 120. 129 consistent systolic blood pressure would be considered prehypertension, and above 139 would be considered hypertension, and the patient should be checked out for that. Diastolic will be between 60 and 80. Heart rate would then be checked. We want to make sure that it's between 60 and 100. Greater than 100 would be considered tachycardia, and less than 60 would be considered bradycardia. And any of those abnormal findings would again need to be assessed by the physician. Then we're going to do respirations, which should be between 12 and 20. And we want to check our O2 saturation, which should be greater than 92%. We want to make sure that we have an accurate height and weight on the patient as well. After that, we're going to go ahead and check the overall appearance of the patient, just a general survey. Looking at the patient, you want to see her mood. Is she happy? Is she sad? Does she look depressed? You want to look at her appearance, good personal hygiene, good posture, good nutritional intake, which you would then compare to her height and weight as well. Are there any obvious deformities that we need to take into consideration about this patient? And then we're going to go ahead and ask her any past medical history, any medications that she's on, and overall problems or reason for the visit today. Okay, so we're going to go ahead and get started on our overall assessment of Miss Barbie here. So throughout our assessment, it's a good idea to make sure that you talk with the patient to get an overall assessment of their neurological function. We're going to go over that again in a little bit, but just make sure that you talk to her, make sure you're asking questions and that she's answering appropriately. You also want to make sure that the patient is not in any kind of pain throughout the assessment, that there's no tenderness anywhere, and if so, then you would go ahead and use a pain scale. We're also going to make sure that we try our best to use good body mechanics because we don't want to hurt ourselves when assessing the patient. So first off, we're going to go ahead and assess patient's overall skin condition. You want to make sure that the skin color is appropriate, that it's slightly warm, slightly moist. Those are both normal findings. That there's no edema, no lesions, no scarring, no masses. If so, then you want to go ahead and clarify what those are from by asking the patient. So then we're going to go ahead and start at the head for our head-to-toe assessment. So you want to check the overall symmetry of the head and face. Make sure, again, no lesions, no masses. We're going to go ahead and check her eyes. You want to make sure that you look at the color of her eyes. The sclera should be white. The conjunctiva should be pink and moist. You want to go ahead and make sure that there are no signs of cataracts or glaucoma. If the patient uses glasses or contacts, you want to make sure that you clarify that, and do a vision test if applicable. So we're going to go ahead and then move down to her nose. You want to make sure that the nares are nice and patent, that the membranes are pink, and you want to make sure that there's no drainage coming from the nose, which could be a possible sign of infection. You also want to make sure that this septum is not deviated, that it's nice and midline. And then we're going to go down to her mouth. You want to make sure that the lips are pink, and that the skin is intact. You're going to use a pen light and a tongue blade and have the patient open up her mouth. You want to check and make sure that the mucous membranes are moist and pink. You want to check the condition of the tongue. You want to check the buccal membranes, again, should be pink and moist. You want to check the overall condition of her teeth. Count the number, make sure that that's appropriate for her age. And you want to check her hard and soft palates. You want to make sure, again, that all the skin is intact in her mouth. You want to make sure that you check the back of the throat for tonsils. Make sure that there is no drainage or lesions, which could be a sign of infection. While she has her mouth open, we're also going to have her say ah. While she's doing that, we should notice that the uvula should rise, which that is a normal finding. So then we're going to go ahead and go to the ears. We're going to go ahead and inspect the overall condition of the ears. And then we're going to go ahead and palpate the outside for any masses. And if we are trying to use the otoscope, we will go ahead and check the tympanic membrane, make sure that it's gray and transparent and that it is intact. So then we're going to go ahead and move to the head. Again, you want to check for overall symmetry of the head. We want to check the condition of the skin and the hair. Skin should be intact, hair should be well distributed. You want to note the condition of the hair, thickness, and color. We're then going to go ahead and palpate again for any masses or lesions, and make sure that it's overall symmetrical. So then we're going to go ahead and move down to the neck. You again want to make sure that you inspect for symmetry. We're going to look at the trachea, make sure that it's nice and midline, that it's not deviated. You want to look at the jugular veins. You want to make sure that they're not distended. We're then going to go ahead and palpate for any masses. You want to check the cervical nodes, make sure that there is no enlargement or tenderness. You also want to check the carotid pulses. You don't want to do it at the same time, just do one at a time, but compare bilaterally, and they should be a +2 or +3. We're also going to listen with the bell of our stethoscope and make sure that there are no bruits, which would be an abnormal finding. So let's go ahead and take a listen. So the bell of our stethoscope is the smaller side, the front is the diaphragm. So we're going to use the bell and we're just going to take a listen and make sure that there are no bruits. And again, do one at a time, don't do them at the same time. Okay, perfect. We're then going to go ahead and check the range of motion of the patient's neck, make sure that she can move it from side to side and around with no pain and no tenderness. So then we're going to check our neurological status of our patient. We want to make sure that we have already checked her eyes for pupil equal reactive. So we're going to use our pen light and we're going to have Barbie stare at an object. Again, not staring at the pen light. And we're going to make sure that her pupils are nice and equal and reactive bilaterally. We're going to go ahead and talk to Barbie, again, making sure that she's answering questions appropriately. And so you want to ask her questions like what year it is, who the president is, where she is. Make sure, again, that she's answering appropriately. That her level of consciousness, you want to make sure you document that. And that she's alert. Any abnormalities, you would want to assess further. If there's any kind of abnormalities with the symmetry of her face, including cranial nerve 7, it could be damage to that, or it could be a sign of stroke. So you want to make sure that you take that into consideration if there's any kind of asymmetry. Last thing we want to do in the upper area of Body's Barbie is just check her temporal pulses. Make sure that they're equal, and bilaterally they're +2 or +3. So next we're going to go down to Barbie's upper extremities. Again, we're assessing the skin condition, making sure that it's nice and warm, the color is appropriate, and that there are no lesions, no masses, no signs of self-harm. We're going to go ahead and check circulation by checking pulses. Radial pulse is going to be on the inside wrist, on the side of the thumb, and the brachial pulse is going to be on the this side of the thumb, on the inside of the upper arm, where the elbow joint is. So brachial is on the outside by the thumb. Inside of the elbow is the brachial pulse. We're also then going to check sensation and cap refill. So we're going to check her fingers, squeezing them slightly, making sure that the cap refill is nice and brisk, which would be less than 3 seconds. Make sure that the patient has sensation. And we're going to check her fingernails, making sure that they're intact, that there's no signs of clubbing, and that the color is appropriate. We're also then going to check range of motion of all the joints, making sure that they can, she can move her arms, wrist, elbow, everything can move freely, that there's no pain, no tenderness, no swelling in the areas of the joints. And again, compare bilaterally. So then we're going to go to the anterior thorax. We're going to take an overall picture of the way that Barbie's thorax looks. You want to make sure that she has bilateral chest rise, that there's no signs of barrel chest, no retractions, no accessory muscle use, no signs of labor breathing. Those are all abnormal findings. You also want to check the condition of the skin, make sure that there's no masses, no lesions, no abnormalities. We're going to go ahead and take a listen to Barbie's lung sounds. You want to make sure that they are clear. You want to make sure that you hear some kind of breath sounds, whether it's abnormal, like wheezing or crackles or rhonchi, or clear, but there has to be something. Absent breath sounds or bad breath sounds. So again, we're going to use the diaphragm. We're going to start on one side, have Barbie take a deep breath, and then we're going to move over to the opposite side, and then we're going to move down. So that way you can compare bilaterally. Barbie's lung sounds are nice and clear, no signs of respiratory distress, no coughing. So then we're going to go ahead and take a listen to Barbie's heart while we have the stethoscope. You want to make sure that you listen for S1, S2. You want to take an apical pulse, which you would listen for a full minute. Make sure that it's regular, that there's no murmurs, no gallops, no abnormal sounds. Okay, so then we're going to go ahead and take a look at Barbie's breasts. You want to make sure that they're symmetrical, that the skin is intact. You want to check for any axillary nodes, that there's no swelling, no tenderness, no pain. One thing that we could have Barbie do is raise her hands up above her head and lean forward. That would show any signs of dimpling, any crevices, which would be an abnormal finding when you're assessing breast tissue. You also want to make sure that you assess the nipples, make sure the color is appropriate, make sure that there is no drainage. So we're going to go down to the abdomen next. In a thin person, a normal sign would be seeing pulsations or peristalsis. Otherwise, unless they're very thin, it's not a normal finding. So you want to make sure you look for that overall skin condition. You want to look at the umbilicus, make sure skin is intact. Again, look for any scars, masses. We're then going to go ahead and listen for bowel sounds. We're going to start in the right lower quadrant and move up to the right upper, and then over to the left upper, and then down to the left lower. There should be bowel sounds in all 4 quadrants. If not, you would have to listen for a full 5 minutes in order to say that bowel sounds are absent. We're then going to have the patient lie down, and we're going to palpate for any masses, tenderness, pain, distension, including bladder distension. You want to make sure that we can palpate the liver, which would be on the right side below the below the ribs, in the midclavicular line. Spleen, kidney should not be palpable. Again, you want to make sure that the liver is not enlarged. We're also going to percuss. We're going to make sure that we can hear a gastric bubble, make sure that there's no signs of fluid in the abdomen. So then we're going to have the patient sit back up, and while we're on the GI system, we're going to go ahead and ask the patient about their bowel pattern. You want to make sure that the patient is having normal, regular bowel movements. You want to ask when the last one was, if they're passing gas. You also want to ask and make sure that the patient has an adequate nutritional intake as well. We're also going to ask about the patient's urinary patterns, make sure that we assess for any pain when urinating. You want to, if possible, get a urine sample or ask for what the color of the urine is, consistency, if there's any kind of sediment in the urine, and things like that. So then we're going to go ahead and move down to the lower extremities. Again, we're going to assess the condition of the skin, make sure that there's no lesions, no masses. We want to check the temperature of the skin, make sure it's slightly moist, the color, make sure that that is appropriate. We're going to go ahead, and if Barbie could take off her shoes, we would have her take off her shoes to assess her toes. We want to make sure that sensation is intact, toenails, skin is intact. We're going to check the capillary refill, which should again be less than 3 seconds. Make sure that there's no signs of skin breakdown as well. We're then going to check the pulses. The dorsalis pedis pulse is on the top of the foot. You want to make sure you compare bilaterally. The posterior tibial pulse would be on the inside ankle. And then the popliteal pulse would be on the back of the knee. Again, all of them should be a +2, +3, and they should be equal bilaterally. While we have Barbie standing, we want to make sure that we assess her gait, make sure that there's no balance issues or coordination issues. You want to check her range of motion with all of her joints, again, making sure that there's no pain, swelling, tenderness with all of her joints. We're also going to check deep tendon reflexes. You want to make sure that the Babinski reflex is negative, but the popliteal and the Achilles deep tendon reflexes are both positive. So then we're going to have Barbie turn around. Actually, we're going to check the strength of her feet. We're going to have her push against her feet against our hand as hard as she can to check the strength of her feet, as well as her hand grasp. We want to make sure that she has equal bilateral strong hand grasp. So then we're going to go ahead and move to Barbie's posterior thorax. Again, we're going to be assessing the condition of her skin, making sure it's intact, no lesions, no masses. We want to inspect and palpate the thyroid gland, making sure it is non-tender and non-enlarged. We are going to check the spine of the patient, making sure that there's no signs of scoliosis or any other kinds of deformities. And we're going to check her scapula, make sure that they are intact and in the correct places and that there's no pain or tenderness. While we're here, we're going to have Barbie do range of motion with her neck. Make sure that she can, again, rotate it, put it side to side, make sure she has good range of motion. And then we're going to listen to her lung sounds. Same kind of way as we did before. You want to go side to side from top to bottom. And you want to make sure that they're clear. like they were in the anterior thorax. Again, you want to make sure that you hear some kind of lung sounds, no lung sounds, or bad lung sounds. So then we're just going to move down to her bottom. You want to make sure that you assess the skin for any kind of breakdown, that there's no sign of pressure ulcers. While we're back here, we're going to check her rectum, make sure that there's no tenderness, drainage, no signs of hemorrhoids or hernia, that the skin is intact. So then we're going to go ahead and lastly check the genitalia. You want to make sure you check genitalia of both your male and female patients. Put gloves on. You want to inspect the skin, make sure that there's no lesions, no masses, no drainage. It's very important. You want to make sure that if you're trained to use the specific tools to inspect the female genitalia, that you do so. Otherwise, you just want to inspect for tenderness, pain, lesions, masses, drainage. So we're going to go ahead and make sure that we clarify with Barbie that all of our findings are appropriate with, that she agrees with all of our findings. If not, we would then assess whatever problems she might be having, making sure to do a more focused assessment on the areas of concern. Again, we're making sure that Barbie is not in any kind of pain when we're doing our assessment, that neurologically she's intact, and that there's no signs of respiratory distress while we're doing our assessment. So once we're finished, we're going to go ahead and make sure that we wash our hands, answer any final questions that Barbie may have, and leave her in a safe environment. Again, bed down low, side rails up, call light within reach. Make sure that there's no obstacles in the way of getting to the bathroom or going out of the room. And if she has an IV, make sure that the tubing isn't tangled up, so that there's no risk for falls. And that's it. That's our head to toe assessment. Thank you for watching. Have a great day.